Yes Health is a community of OneCare enrollees with physical disabilities and mental health needs across the state. Hi, I'm Ginny Alexander, and today I have with me Kimberly Rorsett, I'm going to let her describe the Yes Healthcare and what it does and how people can participate in it. Hi, Kimberly. It's nice to have you.
Oh, it's great to be here. Thank you so much for having me. I'm honored to be here to discuss Yes Health. Yes Health stands for Your Experience, Speak Up for Better Healthcare. And what we are is we're a community of people from around the state who are talking about our healthcare, who are part of OneCare. OneCare is a program for people who are on Medicare and Medicaid combined. And what our community does is it advocates for better care for people on OneCare. So people can come to us, join our community, and take surveys, and we give $10 for a survey, and join a Facebook group, participate in a telephonic town hall meeting, participate in many ways, and advocate for better healthcare under OneCare. And we take the information that people provide us. They provide us information about what they love about their doctor's visits and what they'd like different, and how OneCare, the OneCare program is going for them. And we confidentially provide that information back to providers around the state so they can improve the quality of their care for patients who are on OneCare. So that's what we're about. We're really about giving you the voice, giving you a chance to talk about how you feel about your health care, because people can come out of doctor's visits very happy, people can come out of doctor's visits pretty depressed, and we really want to let doctors know how they can better help people with physical disabilities and mental health needs. So that's what we are about. And we are serving 9 areas across the state. Merrimack Valley is one of those areas. Okay. And people can call in our number, 617-307-7374. That's 617-307-7374 to see about participating. And we're a vibrant community of participants who are making healthcare better for each other and across the state. So,
now, is there a age bracket?
It's 21 to 65. It may be older if people are on OneCare who are older, but it's the age bracket of people who are on OneCare insurance. So when people call the number 617-307-7374, we screen them, and if they're eligible, then they can take the surveys and join, and really can make a difference and advocate for themselves for their quality of health care, and advocate for what does quality mean, you know, like what makes for a good doctor's visit, what makes for a good care plan or care team, what makes for good long-term services and supports. So it's really a way for people to influence the system in Massachusetts. And we think if this program works here, it could work around the country. And Massachusetts is a leader in healthcare. So we are seeing and OneCare is a new demonstration project. Okay. And we are seeing if this works here, it could be expanded to other places.
So you say it's a fairly new program.
Right.
Whose brainchild was this?
So Yes Health is being run by the Disability Policy Consortium in conjunction with the Mongan Institute for Health Policy. So they are out of MGH. They are also helping with this. But basically the community advocacy part is through the Disability Policy Consortium, which is an organization in Malden that is cross-disability and talks about people's, works on policy issues around physical disabilities and mental health needs.
All right, my question just went out of my mind.
That's okay.
But how do you get people to come to you?
So Basically, this program is throughout the state, but you can look up on our website www.yeshealth.org to learn more about the program. And people who call in the number can then complete surveys, can join a Facebook group where we're talking about Yes Health and where we're talking about OneCare and people's experiences on OneCare. And people can participate in town hall meetings, which are over the phone right now, because this is a statewide effort. So that's how people can interact with us.
Do you get referrals, say from MGH or?
We do get some referrals from practices, and we also do a lot of outreach in the community, so that people can find out about this program and know that it's going on, because it's really exciting to be able to speak about your healthcare. And people with physical disabilities and mental health needs have often been low on the totem pole as far as, you know, people really listening to their voices. So this is a unique opportunity, and it's unique because it's also being done by people with mental health needs and by people with physical disabilities for people with disabilities. So this is a really groundbreaking effort that we have going on.
So you said you've done a couple of these shows around the state.
Yeah.
So you're hoping maybe by doing more shows that more people obviously will hear.
Yes, yes. We see these as opportunities for outreach, so people will know that they can have a voice and they can call in and talk about their healthcare and talk about how their experiences are going for them. Because we hear tons of different things. We hear things about people's dental care, we hear things about transportation, we hear things about care plans. OneCare is a new program, and we're just taking in a lot of information from a lot of people so that the providers can really start to listen and change the quality of their care.
And I haven't heard of Yes Health, not that means anything, but could you explain about Yes Health a little bit and why you're dealing strictly with them?
Sure.
For a huge problem.
Sure. So we are starting small. So we're starting with 9 OneCare practices around the state. And what we're hoping to do is see how we influence these 9 practices. If we have a positive influence on them, then we're opening up OneCare to, or Yes Health to people around the state to speak up about better health care. So
basically they could call you if they had a problem. Your whole goal is to improve the health care for these people.
Yeah, if you have a problem, if you're very happy about OneCare, we want to hear that as well. If you have a specific problem that needs resolution right away, we would recommend you call the OneCare Ombudsperson program, which that program solves problems. We are just here to listen and provide feedback in a macro sense back to the providers.
So you say people can find out more information online.
Yes, we have a great website. It's www.yeshealth.org. That's www.yeshealth.org. And we really urge people to visit the site to learn more about our program.
Just seems to me this is a wide open field, especially when it comes to mental disabilities, because I don't care if Massachusetts is leading or not. It just seems like the services are not there.
Right. We are finding out that some services are being done very well, and other services people are wanting more than what they have right now. So, and OneCare offers more services than were offered to people before. So hopefully people are getting those services, and we just want to find that out to see how OneCare is going, and for people to advocate for themselves and say, you know, no, I have more mental health needs that aren't getting met, or I only see my doctor for 15 minutes, or whatever it is. We want people to really speak up because your voice can make a real difference, and that's what we're all about.
So a lot of the times, maybe people with mental disabilities can't speak up for themselves, that they have somebody calling for them, and it gets frustrating trying to deal with the hospital's privacy issues.
Right.
And, if you don't have the right insurance, you can't get in and get the exams or follow-ups.
Right. There are lots of frustrations with the system and with people's individual needs. You know, there've been cases where people with physical disabilities may have been dropped out of their wheelchairs, or things like, you know, so many different things can happen, and we want to know about your experience, and your experience matters, your opinion matters, and we take what you say to heart and respect that, and are enlightening providers about it.
This sounds wonderful. I wish you luck, because I think there's a great need for a program like this. Is there we're running out of time, but is there something that you want to just say to the audience?
Sure. This is a groundbreaking effort, and for you to be part of it is a groundbreaking opportunity. This is your chance to talk to other people with disabilities and mental health needs about the quality of your health care. And there's so much to be said. There's so much richness in each of your experiences. So if you call the number 617-307-7374, that's 617-307-7374, you can see if you're eligible and join our community.
Thank you, Kimberly.
Thank you, Jenny.
We're going to take a short break, and we will be back with Jackie Martinez, who is the Spanish liaison. I, of course, will be asking her in English, but she will give pretty much the same information that Kimberly has given us in Spanish. See you in a bit.
Introducing a breakthrough in time management technology. A whole new day of the week. It's called Someday. Ingenious. Perhaps someday you are going to go skydiving. Enter a hot dog eating contest. Maybe ride a mechanical bull. Now it's on the calendar. You may want to retire someday. Ready for that? You'll really want this. A My Social Security account at socialsecurity.gov. You can estimate your future benefits, plan for your retirement, and how to save for it. If you already receive benefits, you can manage them online. Millions of people already have a My Social Security account. In fact, someone opens one about every 6 seconds. Get yours today, because someday is here at socialsecurity.gov.
Can I go to the sleepover?
Lucy, I want you to promise me something. If there's any drinking, I want you to say, "No thanks, not my thing."
Mom.
I promise you, your real friends won't care. Deal?
I promise, Mom.
They really do hear you.
Did you pack your toothbrush?
For tips on how to start the talk, visit underagedrinking.samhsa.gov, a public service message from the Substance Abuse and Mental Health Services Administration.
Welcome back. I'm going to repeat what I said in the first part. Yes Health is a community of OneCare enrollees with physical disabilities and mental health needs across the state. This part of the show I have with me Jackie Martinez. Did I say that right?
Yes, you did.
Okay. Jackie Martinez, who is the Spanish liaison for Yes Health, correct?
That is right.
I am going to ask the question in English if need be, and Jackie will take the rest away in Spanish because it's needed. So if you could explain a little bit about the program.
Este segmento yo lo voy a estar presentando en español. Estoy aquí representando el programa de Yes Health. Yes Health es para una comunidad de OneCare para las personas que tienen problemas con discapacidades física o mental, y estamos tratando de traer la información a la comunidad latina.
Ages.
Las edades de los participantes entre los 21 y 65 años, y yo entiendo que hay personas que reciben OneCare que tienen más de 65 años, pero ahora mismo estamos mirando a las personas entre 21 años y 65.
How did this OneCare, the Yes Healthcare, come about?
Pues Yes Health comenzó porque nos dimos de cuenta que la necesidad de la voz de las personas que tienen discapacidades no están escuchando. Entonces, tenemos este programa para poder llevar la voz a los proveedores sobre cuál es la calidad de los servicios que estamos recibiendo. Sinceramente, pueden ser problemas severos o pueden estar teniendo una experiencia bastante buena con los médicos y tenemos que dejárselo saber para ver cómo pueden mejorar.
So basically, people are referred to you, or do they have to go online? There's an outreach program that you have as well?
Bueno, nosotros tenemos varias maneras como alcanzamos la comunidad. Hacemos alcance en las diferentes prácticas a través del estado de Massachusetts. También nos refieren las prácticas médicas y también se pueden comunicar con nosotros a través del website que viene siendo la dirección el www.yeshealth.org o nos pueden llamar al 617-307-7374.
I thought you were going to forget that phone number.
No.
Okay. I want to ask you a question that I didn't ask to Kimberly. Where does your research go?
Bueno, la información que conseguimos se la proveemos otra vez a los médicos en las diferentes prácticas a través del Estado, y es para que se den de cuenta qué es lo que están haciendo bien o en otras áreas que pueden mejorar.
Okay, now I'm going to say what I said to her. There's an overwhelming need for people with mental disabilities and physical, but mostly mental, because we recognize a physical disability. The mental is not as easily seen by the average person. So do you have plans to really expand this program?
Okay, so la necesidad de los servicios para gente que tienen discapacidad de salud mental no es muy vista aquí en el estado de Massachusetts. Las personas que tienen discapacidades físicas es un poquito más obvio. Entonces, por eso que estamos haciendo esa conexión, que una persona puede tener más de una discapacidad y cómo podemos conectar los servicios. Entonces, por ahora estamos haciendo el proyecto en solamente 9 prácticas a través del Estado, pero en un poquito más de un año vamos a abrir el estudio para el Estado entero.
How can people enroll in this One Health?
Bueno, la manera que las personas se pueden inscribir es viendo la información en el email, correo electrónico de nosotros, que viene siendo yeshealth@dpcma.org, o pueden visitar nuestro sitio de web a yeshealth.org, o también nos pueden llamar al 617-307-7374.
I thank you very much. I wanted to ask too, I have not heard of OneCare. Is that a fairly small provider?
So, estamos ahora para hablar de OneCare. OneCare es un programa un programa de seguro de salud para las personas que tienen Mass Health y Medicare, o Medicare y Medicare, donde la gente puede averiguar cuáles servicios proveen.
Okay. Now, when they participate, Kim had said they are eligible for $10.
Nosotros sí estamos dando $10 a las personas que llaman, son elegibles y toman la primera encuesta.
And most importantly, everything is confidential.
Y todo, absolutamente todo es confidencial. Es bien importante que nosotros tengamos una voz para nuestra comunidad, específicamente cuando tiene que ver en qué es lo que no nos están dando de servicio. Nosotros tenemos derecho en que nos prueban el mejor cuidado médico, y si no discutimos, no tenemos conversaciones sobre estos temas, nunca lo vamos a lograr. Entonces, por eso es muy importante.
Is there one specific place, or is Yes Health just collating all the information to get back to the doctors?
Cada 3 meses nosotros hacemos un reporte y le mandamos la información a los proveedores, hablando de cuáles son las calidades o descalidades que tienen en su práctica.
Is there anything else that you want to add that I haven't asked you, or?
Bueno, una de las cosas que yo quiero que nuestra comunidad latina sepa es que sin su voz no somos nadie, y en la unión está la fuerza. Y si por favor pueden llamar y averiguar más, aquí estamos a la orden.
Thank you. So we've given you the information in English and Spanish. So we hope that you would go to this website, and the website and the phone number will be on at the end of the program. Get your pencils out. And it seems like a good way of getting heard right now in Massachusetts anyway.
It's a wonderful project.
It's
un proyecto tremendo.
Well, thank you, Jackie, very much.
Thank you for having us.
And that's our program for today. Remember, get your pencils out, write down the phone number, write down the website, and use it.